Hello, this is our nursing assessment assignment.
I'm Amber.
I'm Patricia.
I'm Jenny. The topic we're doing today is cellular regulation, and the exemplar is colon cancer, and the drug is 5-fluorouracil.
Cellular regulation is a cell's drive to maintain homeostasis during all its actions. In regards to cell growth and regulation, it normally involves proliferation and differentiation. Proliferation, or cell division, is a controlled process that's in charge of replacing tissue where the rate of degeneration of old or injured cells happens at the same rate of division. Stop-and-go signals let off by injured or dying cells control when division needs to happen. Therefore, if a cell needs replacing, it will let off a signal so that other cells know that it's time to divide. Proliferation is also controlled by contact inhibition, where contact with cells next to the dividing cell will signal to stop dividing. This is to assure that the cell does not grow past the space that is designated for it, and also so that it does not grow into neighboring cells. With cancer, a cell is injured and the stop-and-go signals do not work, so cells continue to divide when they're not supposed to. There are normally two genes that regulate normal cellular growth: proto-oncogenes, which turn on cell cycle, and tumor suppressor genes, which turns off cell cycle. It is believed that mutations to the cell have activated oncogenes and inactivated tumor suppressor genes, causing now cancerous cells to divide out of control. Differentiation. With here, cells specialize to develop functions different from the cell that it originated from. Healthy cells undergo dysplasia, which is an abnormal development to the cell to become precancerous. If left to continue in this direction, away from the regular state, they will become malignant neoplastic cells. This process can further continue, and the cells will become very undifferentiated and difficult to tell what the original cell was. Our example, colorectal cancer, is found often in males and females, so it is one of the most common cancers. The majority of these tumors are found in the left colon or rectum, so they are more easily to be reached during colostomy. Types of tumors that can be found in this cancer are polypoid tumors. This hangs like a ball in a string on the inside of the bowel lumen. It can also be a circumferential tumor. This grows around the bowel, which can cause a bowel obstruction, or it can be a mass growing within the bowel lumen. Some risks associated with colorectal cancer is age. The risk increases since colorectal cancer is almost always seen after the age of 50. Also, having a family history of colon cancer is a risk. Having ulcerative colitis, and this is because it causes cell dysplasia. Also, having multiple polyps of the large intestine increases the risk. These polyps can be benign, but since they can also be precancerous or cancerous, they're always removed during a colostomy and tested to see if they're cancerous or not. With colorectal cancer, some interventions for preventing, since the risk is higher for anybody over 50, everyone that's over the age of 50 is recommended to be screened. And early detection is very important because if the tumor is detected when it is only involved in the mucosa, then there's a possible 100% chance of survival. Though if it has metastasized, then the survival rate drops to less than 20%.
Some of the most common manifestations of colon cancer are rectal bleeding and occult blood in the stool. As a nurse, we would determine this by taking a fecal sample to test, since a positive result could be indicative for polyps, tumors, or other bowel conditions. The nurse could also inspect the patient's stool to note if it's black, tarry, and has a foul smell, which could also indicate bowel bleeding. Patients could also experience changes in their bowel habits, such as constipation, diarrhea, or incomplete emptying related to an obstruction. The nurse would assess this by asking the patient what their BM's characteristics are normally, asking them about their last bowel movement, and if there's any pain experienced during this process. With colon cancer, the individual may also experience nausea, vomiting, cramps, bloating, and a loss of appetite, which can lead to weight loss. To assess these, the nurse would do a focused abdominal assessment. They could ask subjective questions relating to the nausea and observe characteristics of the vomit. They could also inspect the contour of the stomach to know if it's flat, extended, or scaphoid. When auscultating the bowel, the nurse may note if hyperactive or hypoactive sounds are present. A bowel sound transitions from hyper to hypoactive could be indicative of an obstruction in the bowel. The nurse could also palpate the 4 quadrants of the abdomen to know any areas of pain or any palpable masses. Any pain that the patient experienced can be further examined using the OPQRS-TU tool to better understand that the patient's subjective experience of it. While the patient is being examined, it is important for the nurse to know any objective signs such as their facial expression and any guarding of the abdomen. Lastly, it is important for the nurse to assess the patient's vital signs to serve as a baseline, and to take weights often to notice any weight loss that may happen during the patient's treatment. There are a range of diagnostics used to confirm colon cancer. Some diagnostics include a colonoscopy, capsule endoscopies, ultrasounds, and CT scans. The gold standard for viewing this cancer is an abdominal MRI. An MRI uses radio frequency waves and a magnetic field to detect sources of GI bleeding, which is helpful when staging colon cancer. For a CT scan and an MRI, the nurse should ask the patient if they are allergic to a dye that must be injected into a vein. Specifically for an MRI, asking the patient if there are any metals in their body is important. But to make a definite diagnosis of the disease, a biopsy is needed. This is done by removing a small amount of tissue and examining the cells under a microscope. One of the labs that could be ordered is a complete blood count, which is used to determine hemoglobin and hematocrit levels. With these results, a patient could be noted as anemic, which may suggest a possible bowel bleed. The analysis and electrolyte test could also be ordered to assess kidney function, to determine how well the patient might handle a medication plan to be given to them. A liver function test that would show any elevated liver enzymes in the blood could also be ordered to assess patients' medication tolerance. Finally, a white blood cell count could be ordered to see if there is any signs of an infection that would need addressing in the form of antibiotics. Important nursing interventions include contacting the physician for signs of complications such as a fever associated with infection, signs of hemorrhagic shock, low BP, combined with a rapid and weak pulse. These are possible signs of a bowel perforation, which can be life-threatening. In regards to a partial intestinal obstruction, which include vomiting, pain, constipation, and abdominal distension, a laxative can be given to help ease the process of a BM. Lastly, educating the patient on what procedures will happen and making sure they are comfortable is important to lower any stress and anxiety they may be facing.
One of the drugs that can be used in combination with other treatments to treat colon cancer is 5-fluorouracil, which is an antimetabolite. It is a cell cycle-specific drug that acts by interfering with DNA and RNA synthesis due to its pyrimidine D analog, which can kill cancer cells and slow their growth. 5-fluorouracil must first be metabolized by the liver to form active metabolites, and oral absorption of 5-fluorouracil is erratic, ranging from 28 to 100%. 5-fluorouracil is able to cross the blood-brain barrier as well as areas of body water and tissues such as tumors and bone marrow. 5-fluorouracil is excreted through the urine. Major side effects of 5-fluorouracil include diarrhea, so nurses should monitor for the patient's hydration, electrolyte, and nutritional status if diarrhea is present. Chemotherapy also has a hematological effect, which causes white blood cell and platelet number to drop, leading to an increased risk of developing infections and bleeding. Nurses should assess manifestations of infections such as a runny nose, sore throat, and shortness of breath. Nurses should remember that low-grade fever in patient that is neutropenic from cancer treatment is an emergency. A doctor needs to be notified if symptoms of infection are present, and antibiotics may be prescribed. Monitor for signs of bruising, hypotension, pale skin, and fainting due to platelet numbers that might drop during chemotherapy and cause bleeding. Nurses should always obtain CBC lab values and a set of vital signs before administering the drugs. Any change in vital signs, such as a drop in blood pressure and increased heart rate during the course of chemotherapy, may indicate bleeding. The lowest point of tolerance is known as the patient's nadir, and chemotherapeutic agents should be withheld until patient's blood value returns to the normal range to avoid complications that were just mentioned. Nubigen will stimulate granulocytes, and Numega will stimulate megakaryocytes that become platelets. These two drugs can be used if patient's white blood cell and platelet level becomes too low during chemotherapy. Patient education includes telling them 5-fluorouracil's potential to cause alopecia and that it is temporary. Nurses can also refer patient to counseling and support groups when patients are anxious or experiencing lower self-esteem due to hair loss. Nurses should also educate pregnant patients that 5-fluorouracil may harm the fetus. The desired therapeutic effect is to prevent cancer cell growth and shrink tumor size. To determine the drug's effectiveness, scans can also be ordered to see if the tumor size has decreased or not. The tumor often causes feces obstruction, so if a patient's bowel movement habit returns to the normal state, that is also another sign of therapeutic effectiveness. If bowel obstruction is still present, a stoma may be ordered to help patient to eliminate feces.
Thank you for watching.